It's Amanda Purcell. I'm here to help you guys review the topics wound management and bandaging. But first I wanted to tell you some things that I'm doing to help review for the VTNE. As you know, I'm old school, and so I kept all my handwritten notes in this plastic tub, and I've been going over them as we hit each topic. And also, I got this book that both Sam and Danny recommended, and I think it's awesome, and it's helping a ton. So definitely get it and look through it. Wound management and bandaging. I'm going to cover 6 main topics: phases of wound healing, signs of infection, types of wound healing, treatment and management of wounds, bandaging, and bandaging cautions. The 3 phases of wound healing are the inflammatory phase, which is right after the injury, where you have vasoconstriction, clotting, and then scabbing. The proliferative phase, which is the formation of granulation tissue, and the maturation phase. Signs of infection to watch out for are edema and swelling, pus or exudates, which I like to call wound juice, fever, neutrophilia on blood work, pain, redness, color change, and odor, which is nasty. Types of wound healing. First, we have first intention or primary healing, which are your small lacerations, your clean surgical wounds. Then you have second intention, which are the larger, sometimes infected wounds. These are some cool pictures from a case at my internship. They need to heal from the inside to the outside. Here's some more gnarly pictures. Third intention healing is also called delayed primary closure, and that's when it's allowed to heal by second intention for a few days and then closed surgically. Steps in wound management. You have your first aid, where you're controlling your bleeding and you're examining the wound for signs of debris, infection. Then you're going to clip the hair from the area, and the outer edges of the wound should be scrubbed with a Chlorhex or iodine solution. Wound lavage, it's not just pouring water over the wound. It's really best when it's at least 7 pounds per square inch of force. Not quite a fire hose, but not just pouring it. The current favorite is saline or lactated ringers, but you can also use hydrogen peroxide for lavage, or chlorhexidine, or an iodine solution. The next step is débridement, which means to debride. It's French for removing the icky bits. It can be accomplished by using surgical instruments, or dry-to-dry bandaging, or wet-to-dry bandages, or use of enzymatic or chemical agents. Then you have drainage, which can be active with negative pressure or a pump, for example, Jackson Pratt drain, or passive, for example, your Penrose drain. Bandaging. I'm sure you all remember from nursing lab that bandages have 3 layers. The primary layer is next to the wound, and it can be adherent or non-adherent. Examples of adherent bandages are the dry-to-dry or wet-to-dry that remove necrotic tissue when the bandage is changed. And non-adherent bandages are much more often used when granulation tissue has already started to form, and that's when you can use medical-grade honey as an antimicrobial substance. The secondary layer is the layer for absorption of exudates and for padding, so that's your cotton roll and gauze. And the tertiary layer is the outer layer that provides support and protection, for example, vet wrap or elastic bandage. Bandaging concerns. You want to be careful about restriction of blood flow. It can cause megapaw and tissue necrosis. Most of our patients are going to need an Elizabethan collar to keep them from modifying their own bandage. And we need to educate our clients about preventing strike-through by keeping their pet's bandage clean and dry, and you can give them a plastic cover for waterproofing.